Shaftsbury Select Board discusses mask mandates.
Yeah, I can speak to that too.
Okay.
Good evening. I hadn't intended to come to the meeting, but saw something in the news that prompted an earlier conversation, a couple of conversations I had today that I thought I would share. I'm going to take the mask off, but I'm wearing it for a purpose. This afternoon, the Health Commissioner Levine, Dr. Levine, and the Secretary of the Agency of Human Services called together the Bennington County delegation to share with us what we already knew, the high COVID counts in Bennington County recently. Bennington and Rutland counties have both been experiencing unusually high counts, unusually high related to the rest of the state and historically for us too. And they asked us to do what we could just to encourage people who weren't already vaccinated to get vaccinated, and also to encourage people to wear masks anytime they're indoors for any prolonged period of time, not just in public settings, but in private settings. And apparently a lot of the spread has been people getting together, not necessarily with family, but other people. It might be for a party, but it might not be. That's where a lot of the spread has been taking place. So, those of us who were in the legislature have been encouraging the governor, some of us encouraging the governor to reconsider his opposition to another mandate, a mask mandate. And he's got good reasons, I think, for being concerned about a mandate. But it's also challenging for us. We don't have the authority that the governor has to say, get a vaccine. We know we've been spreading that message and spreading the mask message. Earlier this morning, I was at a press conference with the governor in Bennington. He was down to celebrate the completion of the water line extension in the town. And he mentioned that he was going to be meeting today with the Speaker of the House and the President pro tem of the Senate to share an idea that he had for reaching some sort of compromise. And just a little bit a while ago, news came out that his idea was to bring the legislature back in session sometime in the next couple of weeks. Normally we wouldn't be there until January, but to bring us back in session, he's proposing that we pass a temporary law that would allow individual towns to, if at their discretion, pass mask mandates just within their communities. So you may recall that Shaftsbury took that step last summer, I think it was in July 2020, before the state had made any decision. At that time there was an emergency order in place so towns could do it, and you can't do that now without that emergency order. So I'm here to, I guess, deliver two messages. One is that assuming we do go back into session, and I think it's likely, although I don't know for sure, and assuming that we pass that legislation, then the town would have that option if it wanted to have a temporary mandate in place again. And I'm remembering that there was a request specifically from a business owner in Shaftsbury that didn't feel comfortable saying to its customers, you can't come in without a mask, and was asking to have somebody else at the town level or the state level make that decision for them. So that'll be an option, presumably, that you'll have. And the second is just to say again that the commissioner, the health commissioner, who speaks for the governor, said everybody should be wearing a mask, even in a setting like this. So that's why I came in with a mask on.
That's political theater.
Well,
There really is. There's no science that says those masks work. Actually, the science proves that those masks, that one that you're wearing there or a hat on, does not work. It's like 10% effective, I believe, that the science shows. That it's all political theater. We are the highest vaccinated state in the United States, and we also have the highest COVID count. That tells you what? It tells you the vaccine doesn't work. The other thing that we've been finding out through science is that the people with these new variants are actually being spread by the vaccinated, not the unvaccinated. So Bring a message to them and let them know. Take a look at the science, really. Those masks do nothing. Nothing.
So I'm sharing what I heard today from the health commissioner and just letting you know. And if the board has any message that you'd like me to take, I obviously will.
Yeah.
But the concern is that counts are higher. The hospitals are getting to a point where they're near capacity, particularly for ICU beds. We're okay here at the moment in Bennington. The situation is challenging not just because of COVID, but because of a staffing shortage that is affecting hospitals as well as everybody else. And at some point after Thanksgiving, things may take a turn even for the more worse.
I just wanted to just interject for a second with the mask mandates and all these other mandates. This has really caused a lot of division and problems. People are actually leaving their jobs. It's not good. People in the health service, people that are in police, military, people are leaving. This is not a good time to be, playing political theater with people's lives, and especially when it comes to the jab. It's up to the person, the individual. It's not up to the Joe Biden or con man Fauci to decide that. So.
Okay, thanks, Joe.
And I'm sorry if I feel, if I come across abrasive. I'm sure I am, but I'm really just at a point where I've had it with the whole thing. It's time to say goodbye to it.
Well,
I mean, we can respect it, know that it is a real disease. We know that it can harm you, but it also has a 99.8% survivability. That we also know. So you've got to ask yourself a question. With that as a survivability, do you need this emergency use authorization only vaccine? The answer is no.
well,
You don't.
You'll have your chance to vote, okay?
Thank you, Art.
All right.
I'm sorry, and I guess it just struck a chord.
Okay.
Sorry again.
It's been striking a chord with a lot of people. I know that, Joe. So, yeah, no, don't apologize.
So, is there a message that Joe has voiced his opinion? Anybody else?
I agree with him. I think that I've had 3 shots. If you're going to have the shot, if you have the shot, why do you have to wear a mask all the time? I'm sick of government telling me every single thing when I can wipe my nose or go out the door or in the door or anything else.
I think people have forgotten about the common good. It's not about individuality. It's about the fact that we are, in fact, a herd. We are a population, and we owe it to each other to take care of each other, not ourselves as individuals. I don't find it offensive to wear a mask, although I know there are people who are offended by that. I think the tactic has got to be another way. I think, we're not reaching them. I was interested to hear that one of the governors has stopped funding for people now to get their shot. It's too late. You are spreading the virus. You are the ones who are incubating the variant. The Delta is only the beginning. The next one is the Mu. And that's in there. It's in us, and it's happening. The virus has no other job but to multiply and increase itself and spread. It will spread. I've seen people die. My own children have gotten the virus and suffered for 2 weeks, lost a lot of their senses, are still a little foggy. So I'm telling you, I don't know what the answer is, unless those people who aren't vaccinated finally die. And that maybe it'll be too late by then. But I'm sorry, we have got to talk about the common good. Thank you, David.
Mike?
Well, I can say I had COVID-19 2 years ago, and I survived it. And it had me in bed for 4 days, cold chills, all that fun stuff, kind of a test of your mortality. But, I snapped out of it on day 5, and about 3 months, Tony, it took me to really shake it off. It took a while to, to actually feel good again. Yeah.
5 million people have died,
Yeah.
so it's,
Well, like I said, it's a 99.8% survivability.
so does,
Unless you have underlying conditions, then of course that
does the
changes.
board want to take a stand on whether we meeting here with mask on or anything at this point, or?
I think if a business owner doesn't want, or want somebody to wear a mask, I've seen a lot of people say, get a sign on the door, unvaccinated, wear a mask. If you got vaccinated, you don't need a mask. I think that's the way it ought to be left.
How else can you build faith in the vaccine if you don't?
We wouldn't be voting on anything right now, though, would we?
No, just, you know,
Just tossing around.
No, I support common sense public health measures. I actually worked at the NIH for Dr. Fauci. He was my boss's boss, and he's not a con man. He's a very good man and a scientist, and everyone who works at the NIH is working for public health. I still work for the NIH as a freelance graphic artist. They're not trying to con anybody. They're trying to help. It's controversial, I know. Not everyone wants to get stuck with a needle, but
It's not that. It's just that he has flip-flopped on everything. Not to get into a
No.
debate about it, but he's been proven more wrong than right.
yeah,
So-
I'm just gonna, that's BS.
So you think this may
Yeah, no,
happen?
it is. Well, I don't know where you get your news from, but it's off the meter.
No, it's not.
Yeah, I think that,
you think it will be pulled back into
I
session?
think it's likely, yeah.
Okay.
So, when and if that happens, you'll have a chance to talk about this, which I'm sure you'll all be happy to do.
Yeah.
Again.
Okay.
David, do you know what percentage of actual American citizens in Vermont are not vaccinated? And is it these people that are getting it, that are not vaccinated, are they, I'm gonna say Mexican or southern border immigrants?
No, actually, from what Dr. Levine said today, it was largely, right now, children, under age 11, and until recently, there hasn't been a vaccine for that age group. So it's largely unvaccinated, not entirely. We know that there are certainly breakthrough cases of people who haven't vaccinated. And haven't seen any recent data that would support the idea that there's any racial disparity in who's getting it. It's mostly age-related.
The last numbers that I saw of children that got it, unless they've got underlying medical problems, it's less than 1% get even hospitalized or sick.
I think that's correct. Yeah, they tend not to get as sick and not to.
Unless they're obese or some kind of medical condition.
Yeah, they do transmit it though to
Right.
other, possibly older people who would be more vulnerable.
All right.
But we still don't know the full consequences of having COVID.
No.
I was a breakthrough case, and I'm foggy sometimes. My wife had a stomach ulcer, is that all because of it or what? I don't know, so, yep.
Well, I know that obviously it's a subject with a lot of controversy surrounding it, and I think having this conversation in a civil way around the table is a productive way to do it,
Yep.
and so I appreciate your.
Watch the program in its entirety on our channels or on our YouTube channel, Cat TV Bennington.